I'm Anna Warnicki in Washington. With no driving or flying right now, oil prices have hit an 18-year low. That, on top of international tensions, has some industry leaders calling on the federal government to step in and help. I'll have that story coming up.
Republican efforts to repeal the Affordable Care Act continue despite the coronavirus pandemic. I'm Alexandra Limon in Washington with the latest coming up.
While most Americans are isolating, people in prison don't have the option to do that. I'm Joe Khalil here in Washington. The president now considering an idea to release some prisoners. We're going to have that full story for you tonight.
A federal agency stepping in to create more beds for coronavirus patients. I'm Kelly Meyer reporting from Washington how they say they plan to find the space.
Republican attorneys general continue to press their lawsuit to strike down the Affordable Care Act, and President Trump says he continues to support the lawsuit. But Centers for Medicare and Medicaid Services Administrator Seema Verma says it's not the administration's top priority.
Right now, we're focused on dealing with the pandemic. Obviously, there are problems with the ACA that have created insurance costs that are so expensive that a lot of people can't afford them.
Oregon Congressman Earl Blumenauer says the president should withdraw his support for the lawsuit.
That is the biggest outrage. The notion that he would continue to try and undercut health care for millions of Americans.
Even as the administration is working to end the ACA, it's encouraging more people to sign up for ACA plans, especially the more than 3 million Americans who reported losing their jobs last week because of the coronavirus.
All of those people can come to the exchange and they can apply for coverage today.
The Supreme Court will hear the case challenging the ACA later this year. In the meantime, Republican Louisiana Senator John Kennedy is among those working to prepare for an end to the ACA with a new piece of legislation.
It's real simple. It says everybody's going to cover pre-existing conditions, including but not limited to the government.
In Washington, Alexandra Limon.
When the New York Stock Exchange bell rang on Monday, CEO of Canary Oil, Dan Eberhart, says alarm bells went off in the oil industry.
I've been doing this 20 years and I've never seen oil go below 33, 31, somewhere in that range. Today it's just above 20.
That's the lowest crude oil price in almost 2 decades. Eberhart says there's no shortage of supply, but with Americans staying home to slow the spread of the virus and not driving or flying like normal, demand is drying up.
There's virtually no jet fuel needed, which is about 30% of oil demand typically.
On top of that, the ongoing price war between Russia and Saudi Arabia, after Russia refused to reduce oil production to prop up prices, and the Saudis retaliated by flooding the market. The White House says President Trump is talking with Russian President Vladimir Putin to try and ease the tensions abroad. During a call on Monday, the two presidents agreed that stabilizing the world's energy market is in everyone's best interest. Meanwhile, Texas Republican Senator John Cornyn is working to smooth things over with Saudi Arabia.
They need to understand that if they expect a cooperative relationship from us on arms sales, on a host of other issues, then they're going to have to treat us like a friend.
Cornyn says if oil prices don't start climbing, more than 500,000 jobs in oil-rich states like Texas, Oklahoma, and Louisiana are at risk. In Washington, I'm Anna Warnicki.
While most Americans are trying to stay apart, social distancing is nearly impossible for the nation's prison population.
Let's keep in mind, the least of these and make sure that they are protected and not disposable.
Senator Kamala Harris called on the Federal Bureau of Prisons to release low-risk inmates from their custody And she demanded the department provide details on how it's going to slow the spread of the virus within its walls.
And the people who are incarcerated are not going to be immune to it if they've not taken appropriate precautionary steps.
At a press briefing last week, President Trump said he's even considering prisoner release.
We're talking about use of totally non-violent prisoners. We are actually looking at that, yes.
President Trump said he's considering releasing some prisoners through an executive order, but hasn't said much about it since. Meantime, the idea is getting pushback, and not just from Republicans.
I don't think that's where the major emphasis needs to go.
Democrat John Garamendi says lawmakers should make sure inmates are kept safe, but says releasing prisoners goes too far.
Certainly there's going to be infections in our prisons, and we have to make sure that the prison system is capable of handling that.
The Bureau of Prisons didn't respond to our request for comment, but they issued a release saying they're limiting visitation and transfers, and they say all new inmates will be under automatic 14-day isolation. In Washington, I'm Joe Khalil.
It's called Hospitals Without Walls.
They could use a college dormitory, they could use a gymnasium.
A new program creating room for critical coronavirus cases while continuing to give uninfected patients the care they need.
It allows hospitals to provide services off-site.
Centers for Medicare and Medicaid Services Administrator Seema Verma says the agency is changing the rules to pay for patients' treatment outside of hospitals and clinics. FEMA is already helping expand hospital space in states across the country. Verma says this initiative adds to the work they have done and allows more involvement on the local level.
What we want to do is empower local communities to start thinking about this and to use the resources that they already have in their community.
The CMS waivers will allow hospitals to transfer uninfected patients to these sites, making room for those testing positive for the coronavirus. As far as filling these new spaces with supplies, Verma says they want to make sure healthcare workers have the tools they need to save lives.
FEMA has set a very special force of people that are working to find supplies. And then we've also seen a great response from the private sector in the United States. I think we're hearing every day about companies that are stepping forward to produce ventilators. We heard that from GE.
Verma says new efforts are being made every day at the agency to take care of Americans during this pandemic. Reporting in Washington, I'm Kelly Meyer.